In the face of crises, a beacon of hope emerges. The Barbados Defence Force Field Medical Hospital. In the heart of Barbados, our field medical hospital stands ready, a testament to compassion and resilience. Why is there a need for a field medical hospital?
In 2017, when the Barbados Defence Force deployed to the Commonwealth of Dominica after Hurricanes Irma and Maria, the hospital in Dominica was damaged and we did not have any facility to assist them. The Chief of Staff of the Barbados Defence Force at the time, Colonel Glenn Granham, suggested it would be a good idea for us to actually have some kind of facility that we could assist the people in Dominica. And he then tasked a number of officers to look at how we can have a field hospital, and the concept of the Barbados Defence Force Field Medical Team developed. And within 2 years, in 2019, Barbados was able to classify as a Type 1 EMT under the World Health Organization program, and we are now coming up to our reclassification, which is done every 5 years, but we are now also seeking to do our Type 2 accreditation, which is a general hospital. The Barbados Defence Force Field Medical Hospital comprises of full-time officers, reserve officers, and volunteer civilians who, when we add that up, come to about 262 volunteers we have who give of their time to work with the field medical team. We're always looking for volunteers. If you think of a hospital, we have every department that a hospital has. So we have from the healthcare professionals, doctors, nurses, but of course we need engineers, people who do water management, electricians. All those are posts within the hospital that we need, because it is a general hospital, and when we deploy with about 160 people, but we really have to be 5 deep in terms of our classification. So for every single job in the field hospital, we need to have 4 other additional people. If the deployment is more than 3 weeks, we can change out the staff.
How did the BDF secure funding to make the field hospital a reality?
Well, the funding came from a number of donors. The first people who donated were the Pan American Health Organization. We've had donations from the United States Southern Command. We've had from Massey Foundation, from Maria Holder Trust. We've had from a place called Direct Relief, and of course CIBC Caribbean has been also a donor. Plus there have been a number of private individuals and companies who have also donated. There are lots, and maybe too many to remember to list at this time. The Barbados Defence Force Field Medical Hospital is already classified as a Type 1 facility by the World Health Organization. That means that we are a classified outpatient department that we can do trauma, initial trauma and life-saving support, or just outpatients doing usual outpatient department that you would find in a primary care facility. We're currently now about to be verified for going to Type 2. Now Type 2 is a general hospital. Okay, the Type 2 that we are pursuing verification in consists of a waiting room, a triage department, a resuscitation and shock room, outpatient department, X-ray facilities, obstetrics and gynecology, and delivery suite. It will have a pediatric ward, adult male and female wards, terminal care ward. It will have an isolation ward. It will have a preoperative ward, operating theatre, recovery room, high dependency unit. It will have a sterilizing department, a morgue, a medical laboratory. It will also have a pharmacy, medical stores. We will have then things like a laundry, a kitchen, staff dining room. We'll have tents where the staff will sleep. We have water purification. We have electricity generation. We have incineration. Members of our staff will talk about what happens in their individual departments.
Once funding was secured and equipment acquired, it was time to build the field hospital. This is now the second time within a year that the structure would be erected, this time for WHO Type 2 accreditation. What are the requirements to become accredited for a Type 2 field medical hospital?
Well, an emergency medical team Type 2 provides inpatient surgical emergency care. And beyond the structure that you are looking behind me, they have to develop the capacity and capability to provide this clinical care in a self-sufficiency way in the most austere condition. They need to provide enough staff to cover all the clinical areas, as well as to develop procedures, clinical guidelines, and different tools to be sure that they can provide this clinical care in a safe and timely way. They need to also to comply with some requirements and standards and ratios, at least to have 20 beds in hospitalization. They need at least one operation theater, an area for rehabilitation, for isolation of patients, and a kind of huge of requirements to be sure that this mobile hospital could operate in the most austere condition, fully self-sufficient, and we are talking not just clinically but also logistically. To have an idea, for example, the consumption in a surgery is around 200 liters of water, so they need to provide this clean water to the surgeon and the surgical team, as well as other operational supports. Barbados Defence Force have been and are working very hard to develop this capacity. They have already a huge experience because they were classified as Emergency Medical Team Type 1 Fix in 2019, and they have been working to develop this capacity for these last years, and now they are in the tracking to be classified very soon. So the next step will be the pre-verification once they could finish and complete the rest of the verification package. And after the pre-verification will come the international mission, who will verify that BDF could be classified as International Emergency Medical Team Type 2. But this classification will be a turning point in the Caribbean. Barbados Defence Force will become the first emergency medical team Type 2 in the Caribbean, and will be an important asset during the hurricane season, and any emergency could happen in the Caribbean, to be deployed timely and provide this very specialized clinical care in any emergency disaster or outbreak could happen in the Caribbean, supporting neighbor countries, but also helping in the training and building this capacity to other countries of the Caribbean.
PAHO WHO has been a sound partner of the Barbados Defence Force for many years. What is PAHO WHO doing to support the BDF for this Type 2 accreditation?
Well, thank you for the question. PAHO has a long-standing collaboration with the Barbados Defence Force to achieve the accreditation of this Type 2 facility. EMT facility. Of course, the collaboration will include different areas of support. And all of the support that PAHO provides is really framed within the what we call the Blue Book. And the Blue Book is the classification and minimum standards for accreditation of EMTs and the EMT 2030 strategy. So what are some of the elements of that collaboration? First, is the training and capacity building with the BDF staff so that they can acquire the skills to be able to perform the functions that are needed for accreditation type 2. Second area of collaboration is really in supporting the development of Barbados Defence Force of the SOPs, the standard operating procedures that they need to develop and implement and train the staff. Without the mastering the standard operating procedures, accreditation will be difficult to obtain. The third element is, of course, the procurement of and supporting procurement of equipment and sometimes structures to ensure that the type 2 facility can perform surgeries, can have inpatient, and also can perform emergency services. And last but not least is that of mentorship. The mentorship is part of the accreditation process. So PAHO Regional Center has designated a mentor that works hand in hand with the Barbados Defence Force in ensuring that they advance in the development of the standards and the development of all the things that need to be put in place prior to accreditation. And that mentorship takes place via virtual meetings, in-person meetings, and also consultations. It's a really a very long process, and it's a journey. So with all of that, PAHO is very proud to collaborate with the Barbados Defence Force in this incredible achievement. PAHO is also very proud that this is a development for not only for Barbados, but all for the region of the Caribbean. None of that is possible without the commitment, the expertise, and the driving force of the Barbados Defence Force.
Meet the heroes, our dedicated medical professionals working tirelessly to save lives, often in the most challenging conditions. Could you summarize some of the functions you perform in your unit?
I am Lieutenant Rudolph Morris. I am a member of the field medical facility, but in priority, I am also the second in command of the medical unit of the Barbados Defence Force. So essentially, I merged the two entities together, being within the medical full-time element and also the field medical deployment aspect of the Barbados Defence Force. I'm currently responsible for the initial or the beginning aspect of entry into the field medical facility. So I will start with the area from reception, triage, shock, treatment, and up until x-ray. So those are the areas that I am responsible for. So once we deploy, we set up, and there are two ways that we can enter the field medical facility, right? That is, if it's a mass casualty situation, where we would have an extension on the outside, where we will have an initial triage on the outside to fast track persons coming into the facility. Once you get into the facility, the flow will be the same. Now, the second way is if we are deployed in a situation and persons are brought to the facility where we will have a waiting area where persons will sit that happens in a normal hospital setting. So the reception area, your general biographical data, all the information about you, whatever else is entered by the persons at reception. All right, so we get all that necessary information. You're given a number that we can track you throughout the facility. So once that initial situation happens, you're initially registered, that will follow you throughout the hospital. So even if we lose your name or there's no name, there's still a number that we can attach to you, right? That happens at the reception area. From the reception area, you will come into the triage area where the doctors here then will determine where you will go from there. Now, if you are a red casualty or prime yellow, those kind of situations, you may find yourself going to the shock area where you need urgent resuscitation. Their situation is in that dire need of medical care. We will take you to the shock area. If it is one where it is not so priority, still urgent or still important, we will have you sent then to the treatment area where you will then be treated, where you can then progress onward. There are situations where persons can also be referred straight to this operating theater based on the nature of their injuries and situation. And there will be, once the operating theater has room, you'll be sent down to that area straight. The other persons that will not, category of persons that will not be required to go either to shock or to treatment are the pediatric patient. That patient that is under 16 or thereabout, depending, and that will be determined as well by the country we are operating in. Right? They would, once there's a pediatric patient, they will go straight down to the pediatric area and be assessed and treated. All right? So that is the general flow of what would happen once you enter the facility by whichever means until you possibly have an X-ray.
Could you summarize some of the functions you perform in your unit?
I'm Susan Suku. I'm a radiographer by profession. I'm in charge of the radiology section here of the field medical facility. My rank right now is captain. I run the whole radiology section with all the x-rays, taking images so that the doctor can see exactly what's going on. I give the true picture of inside the person, which is really what I do at QEH as well, as a senior radiographer there. Working and volunteering with this facility, the field medical facility, I am anxious to see it come to fruition and we spread our expertise to the entire region. Yes, I look forward to that.
Could you summarize some of the functions you perform in your unit?
I am Captain Jenny Williams of the Barbados Defence Force Field Medical Facility. I am also the chief nurse for the facility and nurse in charge of the obs and gynae department within the facility. Here, I take patients who have been triaged at the beginning of the system, and depending on the nature of their injuries, then they will be sent to me. So I am set up to take all pregnant women, regardless of the stage of pregnancy of which they are at. If delivery is not imminent, they can be warded here until they are transferred to a bigger facility, a hospital of the host country or home. Or if the delivery is imminent, then we can deliver them here and transport them. We are also set up that if it's a case that they need a section, they can be sectioned. If the section is relatively straightforward, then they can be warded here again until it's time to transport them home or to another facility, or they can be nursed in our high dependency unit if it warrants that. I first of all told them it's voluntary. So therefore, voluntary means no monetary remuneration. However, you have to be prepared to work hard. It is not to come and sit down. You see the facility set up, but it takes hard work to set it up. But the rewards at the end are greater because you know you're setting up something that you can help your Barbadian family or you can help your regional brothers and sisters. You get to practice because a disaster does not say when it is coming. It can happen anytime, any hour of the night or day. So yes, this is to come. I said to make sure when you volunteer, be willing to give of your time whenever asked, if physically possible and you're able to, and know that it is going to be hard work but rewarding work.
Describe the function of your unit.
Hi, I'm Dr. Ayana Crito. I'm a consultant at the Queen Elizabeth Hospital, consultant orthopedic surgeon. I am designated captain in the Barbados Defence Force field medical team.
Here in the Field Medical Hospital, I have the rank of captain. I'm the surgical nurse in charge of the OR team.
So at the Field Medical Hospital, I am part of a surgical team which will be able to take care of procedures that will be of the obstetric, general surgery, orthopedic nature. We will be able to deploy to assist any patients who require surgery. We take care of them perioperatively, both in the high dependency unit and the surgical wards. In our operating theater, we have surgeons, anesthetists, anesthetic aides, and floor nurses, scrub nurses, which assist in making sure that our patients are taken care of during their surgical procedure.
We have the perioperative area first, where our patients are sent to be processed and getting ready for the operating theater. Once they're ready, then they come over to the operating theater where they have the actual surgery done, and after that they're taken to the recovery room or the high dependency unit, wherever the need is.
I'm very proud to be part of the Field Medical Hospital. As a Barbadian, it is an honor to be able to take care of other Barbadians and the wider CARICOM neighboring countries if required. We're ready to do so at any time.
Well, all my life I have been volunteering. Even within the BDF, we have been volunteering to help our countrymen in Barbados when they have disasters. And so it's like second nature to me.
Could you summarize some of the functions you perform in your unit?
I am Lieutenant Thompson of the Barbados Defence Force Reserves, and I am attachment here at the Field Medical Team as a team lead for WASH. WASH stands for Water, Sanitation and Hygiene, three essential components of the Field Medical Hospital. The hospital requires some 21,000 gallons of water per day to operate efficiently and in a safe need for water. One of the first components to be set on the ground would be water. Clean, potable water, medicinal grade. First thing you would do is you look for a water supply. It can be a municipal supply that is coming from the state agency to where we are deployed, or it may be from a river, a stream, or a lake. So once that is done, stringent testing is done on that water. That water is classified as feed water. It's the water that we need to use, that we can actually have provided for the hospital operations. That water then goes through a series of treatment. It is filtered and then it is sanitized using a UV light. After that is completed, then we do chlorine dosing. We use a dosing machine and we administer sodium hypochlorite, which is a concentrated form of the, then brings up the free residual chlorine levels in the water to guard against any possible bacteria that may occur in the water column as it travels along the route. The water is then disseminated across the entire hospital. Some is kept in storage. We keep 2 days supply, 48 hours supply onto what is available for daily use. Testing is done routinely at all points of the hospital, from the initial source all the way down to the final end user.
Could you summarize some of the functions you perform in your unit?
My functions are multitudinal. We have the usual concept. I'm a pharmacist. I'm responsible for all the medications and the use of those medications and the distribution of those medications throughout the facility. I have also responsibilities for ensuring that certain of the medical stores are always available within the facility as they are being used along with the medications. And as lead pharmacist, I'm also responsible for relaying all the information on a day-to-day basis for the use of those items within the facility, as well as sending out reports to the command to ensure that we are restocked in a timely manner. I would say the whole concept of volunteering was a new concept to me when I first started. And the whole concept of a field medical hospital and a pharmacist involved was a great opportunity, and I had to make time. I explained to my family what this would possibly mean, having to volunteer for such services, but I think it's a necessity. In the private sector is very busy, and I have had to find a way to balance it.
Could you summarize some of the functions you perform in your unit?
Hi, I'm Captain Dr. Dana Grandison, a general practitioner in Barbados. But within the Barbados Defence Force Field Medical Facility, I act as the systems lead with direct oversight over our morgue unit. As you can see behind me, we have our FlexSmart 8 capacity unit. This unit works in conjunction with the FlexSmart HVAC unit, which allows for persons to be cooled until their final disposition. Within this facility, apart from this mortuary unit, there are several other small pieces of equipment that are required to allow us within this unit to perform our duty, such as a computer, our labeling system, and certainly the daily administrative process that is usually run by minimum 2 persons, maximum 4 persons at any given time. I do believe that where there is a will, there is a way. And so if at any time I am called upon to give of my time for the Barbados Defence Force Field Medical Facility, I am always willing, ready, and able.
Could you summarize some of the functions you perform in your unit?
My name is Dr. Tricia Boyce, and I am the medical team leader for the medical laboratory. We are pretty much a new addition to the field medical hospital, and this is the area that you see here. Right now I'm standing in the phlebotomy section. This is where we will take the blood samples for the individual. So we are an essential part of the hospital. We provide most of the testing. As you can imagine, we will be places where there have been natural disasters, so we will need to provide rapid and quick diagnosis to help the management of the patients. So here we would collect the samples, whether they're taken in the hospital and brought by the runner, or if persons are doing donations, they come in and they give the blood for the blood transfusions and donations. Currently, the main equipment that we have is point-of-care equipment. These will be to do rapid analysis. So we have a stat machine where you can get rapid chemistry results such as electrolytes. You can also get blood gases. These will help in quick and urgent management of the patient. When you come to give blood for donation, we will also be doing testing for hepatitis B, hepatitis C, HIV, and syphilis. These will help in terms of pre-screening the blood that was taken before we go on to do further testing to prepare blood for blood transfusions. As I said, currently it's a new area within the field medical hospital, so we're still pretty much in the process of getting new equipment. We're looking to be doing full blood count, which we'll be looking like at white blood cells, hemoglobin, and platelets. So in most cases where persons may come in bleeding, we can do a full blood count and get back the results quickly to the doctors. Both of my roles have a lot of responsibilities, but I think so far we have a good team. The team members that we have in the lab, volunteering in the lab currently, they consist of lab technologists, phlebotomists, and other assistants. So once you have a good team, you don't necessarily have to be here physically all the time, because the team will know where they need to fill in and where we need to help. So the team is helping to balance my role as the team lead. I am excited. I think that we have all the necessary talent here in Barbados. We have great doctors that have done training, whether it's through UE or other institutions, and EMTs, nurses. We have a good crop of individuals who are well trained. So I think that we can really produce a good product, and in the case of a natural disaster, be there and provide the best care for the patients.
Could you summarize some of the functions you perform in your unit?
I am Jasper Jerome Blaze. I'm corporate in Barbados Defence Force Reserve. I'm also a member of the Barbados Field Medical Team. I'm in charge of the CSD department, which stands for Central Sterilization Department. I'm the team leader. The role of the team, the CSD team, is to sterilize, clean, disinfect, and maintain a high level of efficiency in the standards of the field medical once we are deployed or even during home base and training. Having the field medical hospital in Barbados, honestly, I love it. I think it's one of the greatest things that happened to the Barbados Defence Force and to Barbados in the last couple of years that comes to this type of operation. We keep telling me we were the few in the Spring Caribbean. I think we have one of the highest level grades. So, and it's an honor, as a member of the Barbados Defence Force, it's an honor to help serve not my country, but regionally as we are called upon.
When time is of the essence, our rapid response teams are on the front lines, providing critical care when it's needed most. In every beat of the field hospital's heart, there's a story of resilience, compassion, and the unwavering commitment to humanity. The Barbados Defence Force wants you to be a part of our team of volunteers.